On occasion, when I've had to deal with families of terminally ill patients, there can be a disagreement with the family members on how they want their loved one treated at the end of life. Frequently, the disagreement comes about as a result of every family member not fully being informed of the diagnosis, the prognosis in their loved one. For some family members, they believe that life is precious to the point where an all-out treatment, aggressive treatment, is indicated. And they don't understand that that type of treatment can be futile and can lead to suffering, and a suffering not just of the patient, but the other family members who probably did not want that treatment. And sometimes there are individual family members that project their values on their dying loved one. In other words, they think that they would want to be treated aggressively to the end, but they project those values on the patient. Instead of using what I would call substituted judgment, and I give them an example of that, I say to them, what if you were sitting with your loved one 20 years ago around a fire in a winter night, and you just had a casual conversation with them and they were otherwise healthy, and you would say, for instance, Dad, if you're ever dying of terminal cancer and you would need a feeding tube and aggressive chemotherapy that probably is going to be futile, would you ever want to have that done? And then I ask the relative, do you think your dad, under those circumstances during that fireside chat, would want to live that way? And then what I see is a light bulb goes on sometimes, and they see that no, that's not how their dad would want to live, and it really changes their whole insight and frequently changes their mind about the treatment. And then by doing things like that, I can get the family on the same page and frequently then make a decision for palliative care or hospice and not aggressive care.